Good morning.
Good morning.
My name's Haley. I'm going to be with you today. I'm going to be getting your head to toe assessment. Can you tell me your name and your birthday?
It's Maren Henry, February 28, 2001.
Good. All right. So I'm going to also do some hand hygiene before I get started. All right. If you would, just take a seat for me.
Okay.
All right. So are you in any pain or anything this morning? No? Nothing? All right. So I'm going to get your head to toe assessment. Can you tell me your name, or you did your name. Can you tell me what year it is?
2024.
And do you know who their president is?
Joe Biden.
And what city you're in today?
Auburn.
All right. So I've noted that you're alert and oriented ×3. Person, place, and time. I also am going to go ahead and check on your eyes. I'm just going to take a look. Just going to note and make sure I note Perla. All right. And I'm also going to have you look at my pen light. And as I bring it away from you. All right. So I've noted Perla. Your pupils are equally round and reactive to light and accommodation. I'm also going to take a look at your ears. Okay. And you don't have any pain or anything in your ears?
No.
Nothing where I'm touching? No sensitive? Okay. All right. So it did look normal. Everything looks good so far. I've noticed that your skin so far is normal for your ethnicity. And it is uniform in color. I don't see any bruising, scarring, lesions, edema, anything like that. I'm also going to take a look at your mouth. Just to make sure everything looks good. I am note that your uvula is midline and your distribution is intact. Your oral mucosa is pink and moist. I am also going to have you just pull down your conjunctiva just a little bit so I can make sure that it's pink. All right, and your sclera is white, which is also normal. I'm going to also check and make sure your nares are patent. If you would just close one side of your nostril for me and breathe. All right, and now do the other side. Right, and your nares are patent. I don't notice anything abnormal. I am then going to go ahead and move on to your next half. I'm going to just take a look first just to make sure that all your skin is uniform in color again. Make sure I don't see any scarring or anything. We'll do some range of motion for your head and neck. If you would, just look up for me and look down. You're going to look left to right. Good. I'm going to also take the range of motion in your shoulders. If you would, just kind of, yeah, and then lift your shoulders against me. Good. All right. So while I have you here, I'm also going to go ahead and listen to some heart and lung sounds. I'm going to listen to a few different ones. I'm going to listen to 5 heart sounds: your aortic, pulmonic, Erb's point, tricuspid, and your mitral. When we get to your mitral, I'm going to take your apical heart rate for 1 minute. And then on your backside, I'm going to listen to a few lung sounds. I'm going to listen to 26 lung sounds. Okay? So if you would just stand up for me. All right, I'm gonna make sure my stethoscope is on properly. All right. Make sure that it is on the right side as well. All right. So I noted normal heart sounds. I didn't hear any abnormal sounds. Normal S1, S2. Didn't hear any murmurs or clicks. I also took your heart rate. I got 82 beats per minute, which is normal range of 60 to 100. At this point, I would have already taken your vitals as well, and if I would have taken your temperature orally, ensuring that you haven't eaten or drinking anything in the last 10-15 minutes. Would have also done your blood pressure on one of your arms, up on the kind of the upper half. I also would have made sure the cup was appropriate size for you. I would have listened for your systolic and diastolic to know where my normal would sit into. I also would have taken your heart rate, which I did, which is 60 to 100 is normal. I would have also gotten your respiratory rate, probably when I did your alpha pulse, so you wouldn't know. And that's 12 to 20 is normal as well. I would have gotten your oxygen saturation on one of your fingers with no nail polish or anything to ensure it was correct, and it would be 90 to 100. It would be 95 to 100 would be normal range. Okay, so I'm going to also go ahead and listen to some background sounds. And while we're doing the assessment, I've also noticed when you walked in and you're standing now, your gait is normal, it's steady, you have good posture, you've been erect, you're not stooped or anything like that. Your speech has been clear. I haven't heard any other abnormal sounds. I'm going to take a listen to some lung sounds. I'm going to listen to 26 lung sounds. Alright. You're just going to take a deep breath every time I move, okay? Okay, I'm going to do some 3 on your side. Now, ideally, I would have listened without your shirt on or at least close to the skin as I can, but for this assessment, I am not going to make you remove your clothing. But if I were, I'd make sure my stethoscope was placed onto your skin directly to hear the best. So I'm going to do 3 on this side. Alright, now I'm going to do the other side. Okay, good. So I'm going to go ahead and listen to some on your front as well. There are 2 places that I cannot hear today. They're just kind of where your arms would be, and it's kind of harder to do that on an actual person. So for the purpose of the video, I will not be doing those 2, but there are 26. I just won't be doing 2 of those 26, okay? Alright, so I'm going to go ahead and listen to the front. Alright, good. So I heard normal lung sounds. Didn't hear any wheezing or murmurs or anything like that. Everything sounded good. Your breathing so far has been rhythmic and effortless. I haven't noticed you using any of your accessory muscles. And again, I've also noticed that your skin is uniform in color. You don't have any scarring or bruising on your back or anything like that. I'm going to go ahead and feel as well for your carotid pulses on either side of your neck. You would just turn. Good. I'm going to feel for the other side. Good. I'm also going to listen for some carotid bruise to ensure that I don't hear that. Using the bell of my stethoscope. Good. I don't hear any carotid bruise or anything. Alright, so now I'm going to also go over some more stuff with you. And with your urine and everything, is it normal in color, normal amount?
Yes.
Okay. Alright, so I'm going to have you take well, actually, I'm going to continue to let you, I'm actually going to have you take a seat. Alright, so I'm going to have you hold out your arms for me. Alright, so I'm gonna do some range of motion exercises with you to ensure that everything is kind of the way it's supposed to be. Stick your arms out and then you're gonna bring them kind of around. And then you do up. And then put them out again. And then do down. Good, so everything looks like you're moving pretty well. You don't have any pain or anything. So I'm gonna take your hands, we're gonna test your wrists and everything. So you're gonna take your hands like this, just kind of move them around. Good. So now we're gonna do your fingers. So you're gonna touch each finger to your thumb and kind of go down the line. Make sure everything's going like it's supposed to. Good. So I'm also gonna test some grip strength for you. So grab my 2 fingers and squeeze. Good. Alright, so that is pretty good grip strength. I'm also going to do some capillary refill on your fingers just to ensure that it's less than 3. So for that, I would just squeeze down on your nail bed for just a few seconds and ensure that it refills back to pink within 3 seconds. I do that on both fingers. And then I can even perform that on your toes as well. If I were, I'd just do the same thing. Alright, so I'm also going to go ahead and do some bowel sounds and everything. And again, for this, I would have listened with my stethoscope on your stomach instead, but for the purpose of the video, we will not. So just by looking, I can notice that it's not distended or anything. It looks normal in size and everything. The color is still uniform. No scarring, bruises, lesions, anything like that. And so first, so just take a look. And then next, I'm going to just take a listen to all 4 quadrants of your belly. So if you would just stand up for me. Make sure my stethoscope is correct in my ears. Using the diaphragm of my stethoscope, I'm going to listen to all 4. Starting in our lower quadrant and tracing your bowel. Good. So I hear normal bowel sounds. I don't hear anything that is abnormal. Normal active, Borborygmi origami is what we'd also call it. I'm also going to listen and see, make sure I don't hear any abdominal bruise. So I'm going to use that with the bell of my stethoscope, just a couple inches above your belly button. And some abnormal sounds. Good. So I don't hear anything abnormal, which is good. Next, we're going to move on to some more range of motion for your legs and everything. So what I'm going to have you do, I'm going to test your hips and knees. So I'm just going to have you lift your leg and kind of put it out and around like this. So, and then same with the other side. Good. And no pain or anything when you do this?
No.
Good. All right. So I'm going to have you take a seat. And you're also going to do some with your feet. You're just going to kind of take them out and wiggle them around like that. Good. And now the other side. Good. All right. So I'm also going to test for some palpable pulses for you. You've got 4 upper and 6 lower. I'm going to be doing your brachial, your radial, femoral, post-tibial, and your dorsalis pedis. Okay. So when if you put your arms out like this for me, I'm going to test your brachial. Good, that's +2. Now I'm going to move on to your radial. Good, I noted about a +3 there. So now I'm not going to do the femoral for the video, but if I were, it would be located about right here is where I would feel for. Now I am going to move on to your feet. I'm going to do your dorsalis pedis and your post-tibial. So I'm going to do this one first. On here, I would feel for the top of your foot. Kind of about here to make sure I ensure that I am having bilateral good feels. Good. All right, that's about a +2. I'm also going to do the inside part of your ankle and this kind of divot. All right, it's also a +2. And then you feel for your other side to make sure they're equal and bilateral. Top side of your dorsalis pedis. Good, and then your post-tibial. Good, also +2 on either side. All right, so now I've also noted that your skin is warm. It's also uniform in color, so is your feet. Everything still looks good. I am making sure everything is uniform color. All your range of motion has been good thus far. All your range of motion has been good. Lung sounds are normal. Everything's been good. And no pain or anything when we've done anything so far. Good. All right. So I am also going to ensure that everything looked good. So we're also going to do your colonus reflex. So we're going to describe that just in case if we were to do it. So for where I would take kind of your foot and hold it up. So it's kind of closer to the ground though in actuality. And I'd kind of hold it up and have you relax. And when I let go, it should just fall right back into place effortlessly. And there shouldn't be any kind of moving like this or bounding or anything. Then we would know there'd be a problem. And it should do the same on either side if I were to do that, right? I'm also gonna test your post-teller reflex. So I'm gonna use my hand in this example, but we might have a tool to do that otherwise. So we're just make sure that your knee just moves slightly. Your leg pops out, all right. Good, and the same. That's a +2 either side. Do you have any questions about any other findings thus far?
No.
Right. Well, that concludes my pre-assessment on you. I am going to make sure that I do some hand hygiene before I leave and everything. I'm going to make sure that your call light was in reach. The side rails are in up ×2. The hip has been maintained, and that you are safe. The bed wheels are locked, and everything is safe on the bed. And then I also noticed too before I left that all your sensation was good. You knew where I was touching when I did, right? You can feel everything on me. Okay. All right. Well, that is all I've got for you. If you need anything, just let us know.
All right.
That felt like